Melinda, for those that haven't come across you online, introduce yourself and tell our listeners what we're talking about today.
My name is Melinda Sue-Ann Lee. I'm the CEO and co-founder of Parcel Health. And at Parcel Health, we develop sustainable medication packaging for pharmacies.
That's a nice, tight elevator pitch.
Thank you.
Who would want sustainable packaging? Would it be the pharmacy because they're trying to look progressive and that kind of stuff? Who wants sustainable stuff?
Yeah. When I started this company, I thought maybe me and a couple of friends would care about sustainable packaging, that nobody else would really care about sustainable packaging because plastic really bothered me. But in my time working in pharmacies, I realized that a lot of patients care about sustainable packaging. People often came in and complained about the plastic pill bottles they were receiving. And so I found out that on one hand, there are pharmacists like myself who really cared about what we were dispensing. But on the other hand, for a lot of patients, they also cared about what they were receiving.
With packaging like that, and we're going to get more into the Phill Box, it replaces the pill bottle. But with packaging like that, you're not offending anybody because nobody usually says, I love plastic.
Yeah.
They might for reasons. They don't want to run over it with their car, all this kind of stuff, or traveling reasons and things. But nobody usually says, I really want to use plastic because I love what plastic does for the world kind of thing. So you don't lose anything there.
I think for sustainable packaging, when we went into designing the Phill Box, which is one of our flagship products at Parcel Health, is really reimagining what the future of packaging would look like. I knew that it would have to be built on the foundations of sustainability, but it could not be only sustainable. Like, we had to sort of rethink what that would mean. But one of the things that we thought about when we were redesigning, when we were rethinking and reimagining what the future of prescription packaging would look like was the opening mechanism, right? Like, how can we develop something that would be simultaneously child resistant, but still easy for the elderly to use?
Which is even hard when you can use plastic. I mean, that's always a battle between easy enough for the elderly and hard enough for the kids.
Yeah, I mean, I've met a lot of elderly patients who, they can always try to opt out of the child-resistant cap, but, in a lot of large chain pharmacies, that just gets dispensed still, and they would just sort of keep it in their cabinet with the cap off, right? That's just how they kept it. We did a lot of these user interviews where a lot of elderly patients were just keeping it uncapped. And so there's that one pillar where we're talking about ease of use for elderly, but still keeping that safety. And the other component of it is just medication communication. If you think about every single product you own in your home, one look right at it, you can see what it is. Even if it's a coffee can, if it's cereal, you look at it and you know what it is. With medication containers, to just even see what medication it is, you have to pick it up. Or even for who it is, you have to pick it up. You gotta bring it closer and turn it just to see what it is, who it's for, and how often to take it. And to me, that was really frustrating because it is one of the items in your household that should be the clearest to see as to whose medication this is, what medication it is, and how to take it. So those were things that we priority, right? It had to be sustainable. It had to be more accessible opening. And third, it had to be much clearer and easier to communicate what is in this box.
And that would be because it's square. It's flat.
It's square. It's flat. One of the difficulties with a cylindrical bottle is that no matter how you look at it, there's only one surface area. There's only one plane. So no matter what, you're going to have to curve around it. Versus if you think about a box. In a lot of different types of packaging, when it's a box, they can put the name of their product on one face and then some small information at the front. But then if you turn it around, you can have the nutrition label, right, on the other end. So it's much clearer. And I think for a lot of patients, what they care about is what medication, how to take it, and who it's for. Those are the three things that patients care about. And it should be on one surface, flat surface area. And all the other information, like who the manufacturer is, who dispensed it, which pharmacy, that information only we care about, right? We pharmacists, that's information we care about. That's what we're federally required to put on there. That needs to just go to the side.
Quite often, I think when we're thinking of solutions, we don't think about that disruption, really. It's kind of the old thing about nobody woke up years ago back in the 70s and said, I want a little thing I can hold in my hand that has 10,000 songs on it. So part of me is saying, ow, just turn the damn bottle in your hand. But wait a minute. If we could start over, if we could do this without any preconditions, let's get a flat bottle that's right there. So when you're going up in the cupboard, you don't have to look around like a 360 view kind of thing.
It should be just much clearer and easier, and the font needs to be able to be larger. I think that's something that a lot of pharmacies also struggle with, because if you want to have a larger font in your label, you have to go up in size on your bottle. And if you go up in size, you're going to create more plastic, and those larger bottle sizes are expensive, right? And so how do you sort of create that accessibility without necessarily needing to take up more space or use up more resources? And having a square surface area just really answers that very easily. We're not asking people to buy a new app. We're not asking people to change their fulfillment system. We're just saying, hey, if your label is printed and had 3 little panels on it, that is going to improve how your patients experience medication taking in that 1 month period when their medications are dispensed. So really looking at like design as a way to improve accessibility rather than relying so much on super high-tech AI technology that a lot of our patients just don't have the bandwidth to adopt.
There's so much talk about compliance and stuff, and a lot of people talk about remember it. And I've got some tablets I take at night, and they're just in my backpack and in a little old guy, don't forget to take your medicine circle with the things in it. But there's so many times where my alarm goes off or I think about it and say, I don't feel like taking it. It's not a memory thing. I just don't feel like getting my lazy ass off the couch and going over and doing it, and I just skip it. Now, that's not good.
I'm going to probably sound a little woo-woo for saying this, but part of our vision is also making medication taking a little bit more joyful, a little bit less stigmatized, right? If you think about how bleach is packaged, if you think about your Tide Pods, that's literally poison. And those things are packaged so much more beautifully than life-saving medication. And so it's sometimes hard to tell a patient, and we have a lot of patients who they try really ineffective medications, ineffective supplements or essential oils. But when you look at the packaging for those items, they're packaged so beautifully, right? They make it seem safe. They make it seem like this is part of wellness. And then you look at something that's packaged in orange plastic pill bottle, it looks worse than how we package poison. So it can be hard for patients who are in their everyday consumer life. They're consuming things. Everything is packaged beautifully that communicates safety and wellness and health and vigor. And then they come to the pharmacy and they pick up an item that, even though we as pharmacists know is very evidence-based, it's going to increase their lifespan and improve their quality of life. But then you put it in this bright orange plastic pill bottle, slap it with a label that has such a tiny font size. You can't read what it is. You can barely read what the side effects are because they're jammed to the side with those little stickers. It can be hard for patients to create that sense of trust with this item that they have to put in their mouth every single day. A lot of patients don't have that issue when it comes to vitamins, right? Lots of people take vitamins daily, religiously. They talk about it. And there's this dichotomy in how we talk about medications, how we package medications, how as pharmacists we view medication packaging versus how a lot of other pharmaceutical companies or vitamin supplements companies that have figured out that if you package things beautifully and label it appropriately, patients are going to have a much better relationship with that product. And so bringing sort of that, a little bit of that into pharmacy.
I guess Apple was a leader on this. Google followed not too far behind. And now most things that you're getting on Amazon, it's all the same damn picture for a earpiece or something. Yeah. There's 80 companies that are buying it from Alibaba or something like that. But they're all doing that. This stuff comes in. It's got a nice little plastic tab that you pull out and opens, kind of like a engagement ring, and this slides out and stuff. And I buy those. I like that better than the companies that it comes in a little 1 ounce Glad bag that goes together. I like it. And I've looked up, despite them all being equal, I've looked up some on Amazon for those companies, and I don't know what the hell company it is, but I know it comes in a cool box.
Yes.
And I'll purchase it. I just feel better about it.
Yeah. It just communicates trust, right? If you care about your product, you're going to package it well, right? And if you don't care about the product, and if it's a low value product that's just whatever, you're going to just put it in a little Ziploc bag and send it on its way. And for independent pharmacies that want to really communicate that when you come to my pharmacy, you're better taken care of. The medications that I'm sourcing are from a trusted source, but they don't provide any differentiations in terms of packaging, that can get lost in the messaging, because you can talk about it all day on social media, but the item that your patients take home and store in their home is still the same packaging that the big chain pharmacies that don't care about them also package it. And so having beautiful, sustainable packaging can really provide that differentiation and really communicate that.
Melinda, have you changed your tune at all after you've had some feedback and things, and maybe you were going for this age group and it's, oh, we were selling this to the elderly, but actually we have to impress the 50-year-old daughters of these people because of this and that. And have you had to change your, I guess marketing would encompass it. Have you had to change your message with the same product, but a little bit different flair to what you're saying? Or has it sort of been the same since the beginning?
Yeah, we definitely changed it. And part of it's from our internal studies, right? So we did studies with adults over the age of 65 and had them survey, do they like the orange pill bottle or do they like the Phill Box opening mechanism? Overwhelmingly, older adults prefer our opening mechanism. And so that was sort of the marketing message while going to pharmacy. Hey, guess what? Your elderly patients are going to like it, blah, blah, blah. But we found that in practice, in reality, elderly patients struggled with change. So even though it was better for them, it was a huge ask for them to be like, you've been getting your medications in a plastic pill bottle the same way for the last 10 years, and now we're going to switch you over. That can be extremely jarring to elderly patients. And so we found that there's sort of like it's contradictory. That on one hand, it's better for them, it's easier for them to use when we survey them, but on the other hand, they don't like change. So they are likely not the right population to be receiving this product. And so in the marketing from our end, talking to pharmacies, is that this is a product that's going to work very well for your 30 to 55-year-old patients. These are folks that are on commercial insurance. This is their first, second, third chronic medication. They're aging into the system. They're used to beautiful packaging. And now they're coming into your pharmacy, right? And a lot of these patients care about small independent businesses. And so how do you stand out to them?
Unless that crowd has already bought an Apple Watch or a Google Pixel or something like that with the fancy packaging, unless they appreciate that beauty, they might take affront to it. Like, oh, how the hell do I use this? It's just got 3 damn pictures on it. What does that mean? Where are the words? That kind of thing. Yeah.
And it's completely understandable, right? For these patients who are older, they struggle a lot getting through the healthcare system, right? Their insurance, Medicare, there's a lot that happens before they get to their prescriptions being dispensed. So I completely empathize with them wanting that to be predictable, right? They figured out a system, even though they keep the cap open in their cabinet, they've struggled with it. They have a system that works. It's completely understandable for them to want to stick to that. Yeah, to the system that has worked for them.
Melinda, I'm jumping the gun here, but let's say that this goes so well that you get sick of it and you sell it off. You sell off Phill Box. Yeah. Because your company is not named Phill Box, it's named Parcel Health. Mm-hmm. When I think of parcel, I am thinking packaging, like parcel post. I don't even know what the hell that means, but I'm thinking packaging. What other areas did you leave open by not naming your company just this product?
That's a great question, Mike. Part of the reason we started our company was really thinking about how a lot of products designed and built for in health are really built for functionality. So if you think about durable medical equipment, different pill bottles, these things are all built just for function, right? And they're not sustainable. They're poorly designed, and a lot of people as they age will really resist picking up good equipment that can help improve the safety in their home, but they sort of refuse that. And so the vision for Parcel Health has always been to develop sort of products that can welcome you into aging in a way that you look forward to it. Because if you told me I needed to install one of those seats in my toilet so that I didn't have to fall through, I completely understand why a lot of elderly folks resist that, because it is an eyesore and it just really ages you. And so thinking about the future of healthcare, what products would sort of receive me, right? Like you were talking earlier about the iPhones and the headphones. Yeah, there are products out there that can do the exact same thing, but when we're using it, we want it to sort of fit our preferences.
There's going to be a lot of things that people aren't going to want to get into things for.
And selfishly for me, it's just as I age, what products do I want to buy to help me age more gracefully? And that would also help others age gracefully and safely instead of sort of creating this resistance to it.
I don't know how you would put lipstick on this pig, though, of adult diapers and things like that.
Oh, yeah, that's a great example.
Who knows if there's some idea out there, maybe fashion diapers.
Yeah, so there's this brand that I really like what they're doing. I mean, they recently got into some controversy for some of the products that they have, but this brand called Thinx. And they basically created these really well-designed products that is for the elderly, but also for women who had just given birth. They're essentially adult diapers, but they're just made to look just like a pair of underwear, a beautiful, trendy pair of underwear that can really sort of take away that stigma of needing to wear a product like that.
Because here's what I'm thinking, Melinda. Think about a Speedo bathing suit.
Yeah.
All right?
Yeah. Yeah.
You'd think trendy is smaller and whatever. I don't have to get into the details. You can picture a Speedo in your head.
Yeah.
But the trendy came in with trunks down to your knees and the pockets and the stripes and things like that. So maybe the adult diapers have to get bigger. They got to get bigger to get trendy.
I mean, women wear certain underwears that make their butts look bigger, right? Yeah. Everybody wants those big butts. And so without going down this rabbit hole, but just there are a lot of products that are designed to be more accessible that can remove the stigma of using.
And look how, and a lot of it's just marketing. I mean, look how Kim Kardashian, basically, she's got a girdle. Do you know what that word is, girdle?
No. Do not want it. I did accidentally say that instead of the griddle, the pan. I think the griddle is something you make pancakes on.
Right.
Yes, I accidentally said that the other way once. So I said I wanted.
Someone catch you on it and preach to you like you don't know what a girdle is?
Yes, they did.
All right, a girdle was just an old lady thing. It was basically Spanx and is it Skins? Is that what it is?
Skims. That's the Kim Kardashian brand.
Yeah, and she had to change that word. She had it. It was a different.
She called it kimono at first.
Yeah, and that was.
That's like a traditional Japanese wear.
Yes.
And her brand had nothing to do with Japanese culture. Yes. Yeah, it was just poor use of word.
So a girdle was an old lady thing. They'd pull it up and jump into it and stuff. And this is just a rebranding of that, basically. That's without even changing it.
Yeah. Compression socks. I mean, compression socks. These days, there's so many cool compression socks. Even with bidets, right? Bidets, for a long time, I think in the US, bidets looked awful. Awful. But you use less toilet paper when you have a bidet. But now they're like really trendy, awesome looking bidets. And those are just like really simple design changes, right? Like instead of making it just white, just adding a little bit of color can really destigmatize it, have it in an older person's home, and people are like, oh, that is so cool, right? That is so cool. Or even the Apple Watch. People hate life alerts because it kind of ages them, right? Like when you wear a little necklace, like nobody wants to walk around thinking that. Very few people like walking around with something like that. But when you think about Apple Watch having the sort of fall alert, an older person or somebody who needs it, they're not going to feel like their life is being limited by wearing the Apple Watch.
I'm already getting into some of that, Melinda. There'll be times where inside I feel young, but I'm starting to age. And sometimes I think people might think about me like I think about old farts.
I know. As a society, we stigmatize old age so much.
I'm getting to be an old fart now.
Yeah.
Well, here's one here, like a cane. I would not want to use a cane. But if I were in the cane manufacturing, I would come at it from a couple different angles. I'd come at it from, it's a walking stick, but it's shorter, so it's a cool walking stick.
Yeah.
And show people out with their grandkids at the park and things like that. Or I would come from at the angle of it being kind of a weapon.
Oh, yeah.
It's like a weapon stick, and you can jam open this with it, and if needed, you can hit someone over the head with it.
Yeah.
But it's just rethinking it and maybe making it more normal so you feel like you're part of the crowd still.
Yeah. I mean, like people who go hiking use hiking poles, right? And those are cool. Like when you go hiking with those, you look like you're a super outdoorsy person when you walk around with those. But yeah, I mean, designing things that are not just so focused on old people or aging or like a disease state, but thinking about how this product could be used for people who have other illnesses or other like weapons, right? That is something that everybody would use, would carry around. Just think about like accessible design. And something I read recently about how we always want safety for others. Like when we think about children and a parent relationship, we always want safety for our parent, but we want freedom for ourselves. And so like when children and parents have these tough conversations of should you go to a nursing home? Should you go to assisted living? The child is always going to say, I want you to be safe. But when it's you in that position, you're always going to say, I prefer autonomy. I prefer freedom.
I'll take a chance of stubbing my toe or whatever, but I want
to be able to go down the street when I want to. I want to be able to hang out with my friends. And thinking about that and realizing that like safety is important, but for a lot of folks like me and you who are aging, we're all aging, we're all going to die. Products that we bring into our lives that we're willing to integrate into our lives has to be something that gives us more autonomy. You're
not aging, Melinda. You didn't know what a damn girdle is.
I think that may be more of the time for the word. I think that word's just not as commonly used.
Here's where I get in trouble too, is my kids laugh at me when I say rouge.
Is that lipstick?
No, it was cheek
blush?
stuff.
Yeah.
Blush. It was blush. It would come out and you'd wipe it on there. But my kids don't like me when I call it rouge. I don't say it that often. It's not like I talk about rouge every day. But when I do.
That is a great name for a brand, though. That should be a brand.
It could come back.
Like rouge. Yeah, no.
I'm not sure if this makes me old, but I have pepper spray now.
Yeah.
Because one of my friends came in the store and he packs the heat, as they say. And I said, are you packing the heat? He said, no, I got it in the car. And we were talking about it. He said, yeah, I carry it everywhere. And I have nothing against guns, but I don't want to own one. So I got online and I got pepper spray. I got it in my car and I have it at the pharmacy. And I actually do drills on it. I pick it up and I see how fast I can put my finger on it. But why not?
Yeah, I carry pepper spray around. And
you do?
Oh, yeah. I carry pepper spray around and I have a pink pepper spray. I mean, I could have gotten the cheaper one that's uglier, but I got a pink pepper spray.
Pink one.
It's something I got to carry around all the time. If it falls out of my bag, I kind of want to be able to like conceal it. Be like, oh, sorry, just put it. It looks like a lipstick, right? I just thought when it's pink in color.
And then some have it on the keychain. Then my friend, we were at dinner and he pulled out like spectacles, reading glasses, but they were in like a little change purse and they all folded out like a transformer kind of thing.
Yeah.
But I'm thinking, how many things can you have? I mean, pretty soon my keychain would look like a big rosary.
I mean, I got rid of my house door. I don't have a key for it. It's just it's a little keypad.
A little keypad.
Because I forget my keys all the time. But that sort of has freed up my keychain to hook a lot of different
other stuff on it. To do other stuff.
So I think maybe even the future, calling it a keychain would be almost like a...
Well, it's kind of like the glove box on a car.
No, I think I call it like the... No, I do call it the glove box, yeah. What did they store gloves in it?
They used to keep gloves in it.
Okay, because?
Just because you needed a spot to put your gloves, Melinda. Now that you mention it, it might have been that people had driving gloves and they stood in there. I always thought about regular gloves.
Yeah. Winding down the window? Do you remember winding down the window?
Winding down the window.
Yeah. My brother, he's 17, so he's 13 years younger than me. He's never needed to wind out a window.
Yeah.
And so he was sitting in my dad bought me a really old car when I was in Malaysia. And my dad's like, wind down the window. And he had never wound down a window before. So he went to the knob and he just spun the knob, hoping that the window would come down.
That's great. He spun it. That's great.
He's, what do you mean? He's like, how do I get this? My dad's just turn it. And
that's
like,
funny.
He like turns the little knob.
And some of those phrases we still use. Hey, roll down the window. Usually say roll it down. You don't say put it down or
press the button.
Press a button to have it go down.
Yeah.
What was your biggest misconception when you started this?
My biggest misconception is that being environmentally friendly was enough. That was my biggest conception. So when I started this product and I was like, as I mentioned earlier, with all this stuff, I'm like, oh, it's going to be cool. But I just need to go in and I just need to show them it's compostable, it's recyclable. People are going to get it just like that. And that's not true. People care about sustainability. They'll open the door and they'll listen to you about sustainability. But that's not the reason why people will give you money for it. A lot of our customers, they'll be like, yeah, that's really cool. I care about the earth. I care about sustainability. But the part that gets them to be willing to invest or turn over the money to buy this product, to invest in it, is completely different from sustainability. And that it's so silly of me to have gone and having that misconception, because it's the same thing, is the same way that I react to a lot of products that are marketed as sustainable, right? If you think about cars or solar panels or whatever. Yeah, it's sustainable, it is great for the planet, but it needs to have something else, right? Like with electric cars. Yeah, it's going to save me money on gas, but it's got to be cool, or it's got to have good mileage, right? Or it's got to be able to do all these other cool things. Same thing with solar panels. So I thought that sustainability was enough to convince people to purchase a product, to try the product, but you really need more than that. People will listen to you, they'll open a door, they'll listen to your pitch, they'll talk to you about sustainability. But the part that gets people to turn over their money, to open their purse and said, okay, instead of buying this other thing, I'm going to buy your thing.
Yeah.
It has to be more than sustainability. And I realized that in my own experience, that is the same, right? I don't just buy an electric car because it's more sustainable for the environment. I buy an electric car because it comes with all these other awesome features, being able to save on gas, being able to use my car as a battery to reverse charge my house, things like that. Same thing with solar panels, right? People don't just install it for the environment. They install it because it's going to help them save on electric bills.
We bought, some of my daughters are into that, and we got this laundry sheets or something.
Oh, I know what you're talking about.
They're kind of gelatin. It's supposed to be washing detergent, but they come almost like Kleenexes. They don't pop up like that. They come just like in a stack of sheets, like napkins, sort of. Mm-hmm. The sustainability and the green and stuff is fine, but they do have to work. You throw one of those in the laundry, but it didn't work. And stuff has to work first.
Yes, and they have to work better. I almost find that sustainable products, they cannot work less than, because think about like paper straws, right? Yeah, everybody hates paper straws. When we were developing our product, I was like, I don't want to be the paper straw to plastic straws. It's actually got to be better. I want it to actually be better than what exists today, because that's how you create lasting change.
Part of the problem with the paper straws is they come like in plastic wrappers. So that'd be like you guys selling these prescription bottles like in a Tupperware box or something like that.
Yeah, they get so soggy after use and nobody looks forward to it.
It feels like you're sucking on a piece of chalk.
Oh, yeah. And sometimes you can almost taste the paper. Yeah.
It's terrible.
Yeah. So we cannot beat that, right? Like people are willing to pay a little bit more. People are willing to change their habits a little bit for sustainability. But it really cannot be worse than its predecessor. And that's sort of what the plastic-free movement sort of has to always grapple with, is that whatever you design, it's got to be better than plastic.
In our pharmacy, I made some changes years ago that a certain population liked. I don't make many stances at the pharmacy, but it's something I took a little bit of a stand on. And people say, well, you're going to lose some business for it, but you're going to get a lot of people that really respect that and are doing this and that. And I was like, nah, they'll say it. And they'll maybe come to us if they're 2 miles away from us, but they're not driving from that far away. So it's got to be equivalent, but it's got to tip the scale.
Yes, yes.
Melinda, that sort of had to be a little bit of a kick in the teeth to, I know that wasn't the only part of your product, but it was a front selling point. So you had to sit there and say, I thought this was a big part of it. Now I got to make something else the bigger part of it.
Yeah, absolutely. I think with a lot of sustainability initiatives for a lot of large corporations and a lot of businesses, it can sometimes be feast or famine. That's what I was told. It's that like when it is a priority, you might get a huge interest. But when it is not a priority, nobody's going to spend money on this.
Yeah.
And so understanding that's how it works. And it helps that I really care about this, that understanding that's how it works, to really start thinking about how else can we provide value to the customer. And yeah, we may lead with sustainability, but we're going to have to close the business talking about something else. We're going to have to talk about
close the sale.
Right. We're going to have to talk about workflow improvement. We're going to have to talk about marketing budgets. So as an example for us, what has worked for us in the past year that we found is that helping people understand that this is the ultimate marketing tool, right? There is nothing that you will be able to spend money on that's going to sit on your patient's countertop every single day and that they're going to interact with once or twice a day.
Melinda, if someone told you the best way to ever advertise something, can you imagine telling a company, well, you can imagine it, but you say they're going to pick this thing up 1 to 4 times a day. They're going to stare at it and they're going to do that every day for the rest of their lives kind of thing. I can't think of another product.
There is nothing else that could provide that sort of ROI for marketing.
I can't think of one that would be maybe your phone, but that changes all the time.
And that's why people pay so much money for social media advertising, right? People are paying per impression. Think about for a company's marketing budget to appear in front of a person's feet every single day for 30 days. How much did that cost, right? And realizing that was a much more compelling value proposition was really crucial for us. And it is the absolute truth, right? Part of why we wanted to go into innovating medication packaging was also realizing that this was a product that someone is going to interact with very often. And it's also going to be a product that when they interact with, they're going to be remembered that they have a disease, right? That they have a chronic illness. And so how can you make that interaction be a little bit more pleasurable, right?
Yeah.
Rather than, oh, I got to take my medication because I have diabetes. Be like, I'm taking this medication because this is part of what's going to make it easier for me to live with diabetes.
Melinda, before we get to the end of the show, I think we should share with people what this is. It's a Phill Box. It replaces the plastic vials, but it's a box shape.
Correct. It's a box shape. And we do full printing on it so that it is basically your patient's almost immersed in your branding when they use a product. It's food safe, it's water resistant, and pharmacies fill it just like they fill their orange plastic pill bottles. The Phill Box is square, it is water resistant, it's humidity resistant up to 3 hours.
No, it's not square.
It's rectangular.
I'm going to say it's a rhombus. I don't even know what rhombus means. It's just funny to say.
It's not a rhombus. It's like a pit. No, I don't even know how to describe it.
It's like a building.
Yeah.
It's like a train car stood on end.
Yeah.
Or is it more square than I'm thinking? I'm thinking it's taller than
it's not a perfect
right?
square. So like the shape is a square, so it has 4 sides, and then it goes
taller than wide.
Yes, it is taller than it is wide.
Gotcha.
And
I think our listeners got it.
Yeah. It's simple. I mean, it looks like a carton, a milk carton.
A carton. There you go.
Yes, yeah, it looks like a milk carton, but for your pills.
I think people can picture that. What's the actual take the medicine out? Is it kind of like a matchbox where the bottom spreads apart, then you take it out from down there basically, or pour it into your hand?
Yes, absolutely. So it's just like a matchbox. And in our early designs, we had it like a matchbox where if you think of a matchbox, when you open it, the hole for where the matches come out of is gigantic. But we wanted to sort of make the medications come out in a more controlled pour. And so we have a smaller hole so that's at the edge of the carton to make it easier to dispense 1, 2, 3 pills.
We used to have people would come in and they'd try to sell us ads on the pharmacy bags. I think my dad, rest his soul, did it one time.
Yeah.
But you'd have stuff on there like tattoo parlor or something like that on your pharmacy bag.
Yes.
I'm making that up, but kind of stuff.
I just learned about this last week where people would put funeral homes on the RX bag. And I was like, that is so terrifying. Can you imagine dispensing to your patients like, well, if this medication doesn't work, there's another number here you can call.
My dad didn't even let us when we'd put the antibiotics, she'd put, take 3 times a day until gone. And my dad would say, don't put until gone in there because it makes it sound like they're dying. We'd have to put until finished. But you're right. It had a car place on it and dinner mats and restaurants and things. Melinda, with that said, I know we've talked about it gaudy and stuff, and I don't think you're going this route, but would anybody else put their marketing on it for a pharmacy, or would it always be the pharmacy doing their services as far as marketing goes?
Mm-hmm. So our focus is to really have the pharmacy be the one that sort of controls that packaging, because that is this again is the thing that you're going to dispense your patient that's going to sit on their shelf every single day. What do you want to associate yourself with? With that said, I think that public health messages would work very well for it. So for example, like vaccine campaigns or campaigns for exercising more, I think things like that can be sponsored for the box at the pharmacy, that where it would be sort of a mutually beneficial, where the pharmacy is promoting a health message. But that would probably be the limit of what we would allow on a packaging. I think it's kind of cheesy to sort of put, vitamins or something else on it.
Melinda, what does your typical day look like? And what I mean is, how many people do you see? Where is the business out of this kind of thing?
Yeah. So I have an office. So once or twice a week, I'm able to go into the office. I work with my employees. We do a lot of different adjustments to the box, making sure it's manufactured more efficiently. But on other days, I do marketing. I do a lot, social media planning, marketing. Other days, I talk to our CFO and we talk about our budget and fundraising and investor relations.
How many people are involved?
Yeah. So full-time, it's me and my co-founder. If you interact with, in any form, Parcel Health, you're either interacting with me or my co-founder. Sure. Yeah. And then we have about 7 part-time employees. Some of them are exclusively assembly technicians where they put together the boxes. Others are sort of doing more of our research or outreach or marketing.
Who made the decision? I take it you guys did, but who was involved with the cut of the cardboard? Like, we need this many millimeters here and so on. Who designed it?
Yeah, it was primarily my co-founder and also our creative director who's on our team. So there are folks who, both of them are experts in sort of paper carton manufacturing and design and are very intimately aware of design principles. And we experiment with all sorts of different paper grammage, paper types, paper manufacturers, coatings to really arrive at the Phill Box.
Was there any thoughts of variation? Not that you should, but were there thoughts of variations of little tweaks here or there? And then you said, let's keep it the same?
Oh, absolutely. A million. We've got so many. We've talked about using a round cylindrical tube, right? So just mimicking the orange pill bottle as much as possible. So using a paper tube. We talked about, so right now we have the Phill Box has 4 sides, so it's a square carton, but we have talked about making it 8-sided or 6-sided. And part of the reason for that is to accommodate different dispensing holes. So could we have different dispensing holes on different sides so the patient can sort of choose which hole they want to use, for example. We've thought about having a very thin and tall carton that looks more like a Tic Tac box. So lots of different shapes. And the really cool thing is because we use paper, ours is a paper-based product, so we can do a lot of different cool things to accommodate needs for medication packaging.
To make the older people feel at home, you should make a good old cigarette carton.
That's a great idea. Yeah, a little open it and then you pull a little medication out.
Yeah, and then before the people open it, they do that tappy thing.
Yeah. Just 2 days ago, I went to watch Barbie, the movie. Have you watched Barbie?
I have not seen it. My kids went, but I haven't seen it yet.
Yeah, great movie. Yeah, and bought candy, and there's a candy box. So we were shaking the little candy box. Sure. And you can poke your hand. Obviously, it's not child resistant, and once you open it, you can't reclose it. But, people are very familiar with this form factor. They're very familiar with paper, and paper is also instantly communicates that it is sustainable, that you can recycle it or compost it, versus a lot of other materials out there that you might have to do a lot more education just to get the same point across.
People call us, we don't have it. Do you have the pill package thing where you do this or that, or can you spread the pills out for this elderly
like the
person and
packaging
stuff? Yeah, I imagine that's crossed your mind about doing a 7-day something or other.
Yes. We've been wanting to make, what are those for Christmas? Like 25 days pulling up to Christmas. There's a name for that thing.
A calendar?
Advent calendars. We've been wanting to make
yes.
We've been wanting to make Advent calendars for a medication box because again, people are very familiar with Advent calendars. Of every day you open it, and people are so excited to open Advent calendars, right? And so, sort of replicating that sort of joy, especially if it's like building up to a holiday season. So Advent calendars is one of it. One thing that we are developing is actually a better secondary box for those pill pouches because a lot of pharmacies have come to tell us that they can dispense the roll of medication in those plastic film pouches, but when you put it in a patient's house, they're kind of struggling with it. There's no hinge, so you're just kind of struggling to pull that packet out. The box is square, it's very flimsy, but it doesn't have a hinge for the roll to roll on. And so these are things that just, if we just slow down a little bit and we just think about it from like a design perspective of like how to make it easier for patients, it's a very simple problem for us to solve.
Melinda, explain the safety mechanism on this.
Yes. So the safety mechanism we developed is a 3-step mechanism. So instead of a push twist motion where you need 2 hands to push and twist and you need strength, our mechanism, which is what our submitted patent is around, is instead you push the inner box in, press a button, and then you pull it open. And this motion doesn't require strength, like wrist strength. It also doesn't require like wrist mobility, which a lot of elderly people struggle with.
Right.
And so developing a mechanism that only requires your thumbs and your index finger is just a lot more accessible for a lot of people, not just elderly folks, just folks in general who have limited hand dexterity.
And is it like a tab that gets in the way, or what's the physicalness of that? What's happening?
Yeah. So right inside the mechanism, there is a little tab. So if you don't push the inner shell in, it doesn't get unlocked. And so there's another piece of cardboard inside that sort of prevents the lock from opening. But when you push the inner box up, that sort of puts it in an unlocked position. And when you press a button, it allows the whole box to slide out.
This is all paper. Is it all one piece?
It is 2 pieces of paper.
Obviously, because one's the bottom.
Mm-hmm.
Is the locking thing you mentioned, that's either part of the top and the bottom. That's not a separate pasting thing or anything.
No, yeah, we engineer it so it's all one piece. It just makes manufacturing easier, assembly on our end easier. And so it's 2 pieces that fit together that creates that lock.
It kind of starting to sound a little bit like origami. Like there should be like a,
yes,
what do you call that? Like a swan or whatever they do in origami.
Mike, on days where previously, when we were at the beginning of my journey building this company, there were days where I would lay on the floor and I'm like, what am I doing with my life? I'm a trained pharmacist and I'm out here selling an origami box. So yes, that is something, it is using just how paper behaves. And paper is a really fascinating material. It is rigid but flexible, and it has a little bounce to it. So we take advantage of how springy paper is when you bend it in a certain way to also work with the lock. It's very unique as a material compared to a lot of other materials. And it's also really the only material that can rival the price of plastic out there. Very few materials in the world can rival the price of plastic.
Paper or plastic, they asked that, right?
Yeah.
And they probably wouldn't ask it unless it was fairly close. They would just grab for it in the grocery store.
Yeah.
Melinda, so we have all this. Then what's the sales strategy? What has that been?
Yeah. Something that we learned is, so at the beginning, if you had seen our early designs were heavily branded with the Parcel Health branding.
I remember that from a little bit ago. Yes.
That was an awful strategy because we were selling these products to pharmacies and pharmacies would be like, why would I be pushing my patients to use a product that didn't have my brand on it? Which is completely understandable. Like, you don't buy an Apple product and open and the packaging is this other packaging company's brand name on it. So that was a huge mistake on our part. And so now...
Wait a minute, though. There's a lot of things, though, the iPhone and so on, that I don't have an iPhone.
Oh, my gosh.
I'm an Android guy.
You're an Android guy?
I'm an Android guy. Oh, my whole family is iPhone, and I'm Android.
You got to get on the Apple train.
Here's why I don't do it, Melinda. Years ago, now you don't even know what a girdle is, so you're not going to follow this at all. But years ago, Apple, they had the iTunes. This is when the iPod came out, but not the phone. They had the iTunes. And you would then buy your songs, 99 cents. But then you'd want to share those with your family because you bought them. You're not sharing a service. You actually own the song for $1. Then you want to share it. So then they had the password, and then they had 4 other passwords for your family.
Oh.
It was really clunky. All right, so... time goes on, and I'm like, screw that, I'm going to Android, because that's just a Google password for everything.
I see.
So we've got these phones that float around the family somehow, and my youngest son wasn't old enough to get his own iPhone password, and instead of faking his age, I wanted to set a good example.
Yeah.
So then all of a sudden, like, my brother is messaging me some off-color joke that 50 and 60-year-old guys tell each other. And pretty soon my son says, "Hey, Uncle Pete, this is Drew." Because he thought he was going to me. It's clunky, all these passwords all over the place. So anyways, that's why I'm with Android.
I see. Interesting.
All right. So my point is, Melinda.
Yes.
When you have an iPhone, you want it to say iPhone because the brand is known. So I think Parcel Health could put a stamp similar to a Good Housekeeping thing on it. But I guess the problem is it's not known enough that it's going to pull attention to it. It would just really pull attention away from the pharmacy.
Yeah. I mean, thinking about who is the purchaser of the product, right? And so knowing that like the people who are actually our true customers are pharmacies, and for them, marketing is something that really differentiates themselves from their competition, right? Like pharmacies have a hard time competing on price, and so they really think it's marketing. And pharmacies spend time and money developing their brand, and they want their brand on it. And recognizing that, our sales strategy in the past 6 to 8 months has been developing these fully customized designs for pharmacies to really allow the patient to bring that brand back to their home and keep it there. And when it's done very beautifully, patients leave it out and about, and it sort of advertises the pharmacy to other members of the family. And so realizing that has been really important to us. And of course, we still put our brand on it, like in the little corner that says Parcel Health. It doesn't mean anything if you don't know who Parcel Health is. And when you're a small startup like ours, like our own internal marketing budget, we have to be really smart about who we market to and how much time we want to spend.
Yep.
Direct-to-consumer marketing is just so incredibly expensive today.
Yes.
If you don't have that expertise or that edge, any money you spend on social media marketing, you might as well just flush it down the toilet.
You think, well, of course, we're not going to advertise this to plumbers and this and that, but even going to pharmacists is way too wide.
Yeah.
You might even go to the pharmacy kind of partner or something, and they might not even be the person. So you really got to narrow that down to the decision maker.
And decision makers spend time thinking about their own brands quite a bit. What your pharmacy stands for, what it means when your patient sees your logo or your storefront. And so recognizing that and saying that's what the pharmacy cares about, that is what we're going to place on the box. We're here to help pharmacies build that relationship with their patients. We don't really want to get in the way. And so, I mean, we spend a lot of time helping these pharmacies design these boxes so it stands out, because this box is not a billboard. It's not flat. It's 3D. It's a 3D box. And so it's on one hand, it's challenging to convert a flat 2D logo into something 3D. But on the other hand, it provides a really awesome opportunity when it's done right to really make it a lot more immersive.
On your LinkedIn, I guess, I like the packages because of that 4-panel thing. The logo can wrap. You could have, I'm just making this up, but you could have one of those pharmacy snakes going around it. It's not just one side of it. So that's a cool pathway than just one side.
Yeah, absolutely. And one thing we've also recognized is that a lot of pharmacies are also doing really cool things other than dispensing medications. Pharmacies are either helping patients administer injectables, or they have vaccines, or sometimes they start doing a little bit more clinical work. Being able to sort of advertise that in a very simple way, right? Just some of our pharmacies are going to start adding a little QR code that says scan to make an appointment, right? And that's something your patient's going to see every single day when they open their box. They're like, well, maybe if they came down with the flu, they could interact with that very quickly and very easily. That's really important for the pharmacy, right? Because you can add so many services and create a link on your website, but that doesn't mean your patient's going to realize that's what you're offering now. And how do you communicate that? You can print flyers, you can talk to them, but it's very different from being there when they actually need you. At the moment when they're like, oh yeah, I should just book my vaccine appointment. And so providing that as well is super helpful. And those 4 panels you talked about, that's all surface area. That's all marketing real estate that we can take advantage of that just traditionally has not been available.
And I imagine not only traditionally available, but let's say you had this package 10 years ago. That's a different story of individualizing it. I mean, you'd have to take it to a designer and have
would not have been possible.
What do you call that?
Ago.
Screen print. I don't even, you know how they charge you for changing colors and all that. And now I know it's still expensive, but it's come down dramatically.
Yeah, and even software, we can make design edits really quickly, right? Send it to the pharmacy, get them approved, and send it back. And these days, a lot of pharmacies also recognize the value of branding, so they already have logos and colors ready to go. But 10 years ago, that may not have been present, right? They might not have a website, they may not have a prominent logo, they might not have any social media assets. This product could not exist 10 years ago, just from a manufacturing and just like efficiency standpoint. But in today's world where everything is so colorful and engaging, it's become sort of a necessity.
Have you ever seen the YouTube video where it says count the people that are throwing the white ball to each other? Did you ever see that?
And then does a gorilla go by in the
back? A gorilla goes by.
Yeah.
And for our listeners, they say, count how many times these 5 people are throwing this ball. And you count and you're like, okay, 14. And then when it's done, they say, did you see the gorilla doing the moonwalk in the background? Or not even in the background. Did you see the gorilla doing the moonwalk? And you say, no. And you watch it again. And sure enough, there's this gorilla walking through.
Terrifying when you see it because you're like, makes you question your reality.
It shows you, even if you think you've got the advertisement, they're going to see this because it's right on X, whatever it is. Of course they're going to see it and know it and read it. And it's like, you can watch a video, not even see the damn gorilla. So why do you think people are accepting this into their mind? And who knows, maybe they don't do it on the box either, but the point is, sometimes it needs to be seen over and over again. And when it's in their hand, and then maybe they'll see it after 20 days, they don't even realize it.
I mean, in pharmacy, we talk a lot about like right dose, right time, right patient. And sometimes a lot of those things have to align, right, for the patient to really get it. And so there are a few things that you can't really control right timing. You try to, right? From someone who's spending money in marketing, you try to control the timing. You try to show up in social media when the patient's a little bit more relaxed. Maybe they'll see it. Maybe on Facebook when they're interacting with their family. But a lot of that you can't really time. And so something that's a little bit more physical helps. And there's sort of a resurgence in physical marketing too, right? People are finding that when they send mailers out, because people don't get mail as much anymore, they might keep it around a little bit more than just toss it straight into the recycling bin.
Melinda, I just did that. Things are easier now, talking about print and so on. I just sent to our top 300 doctors who we have the most deliveries from. I did a plain old postcard to them. And it's easier now on, let's say, Vistaprint. You go in and you give them the list and it does the bulk mailing and all that stuff. It's a lot easier than it was even 5-10 years ago. But that's my thing precisely. It's like things are so overloaded that sometimes now just getting mail to somebody is good again, to the right person. And here's my trick, Melinda. The best way to get everybody in the office to see it, you put a doctor on there who doesn't work there. Right?
Oh, and then they're like, oh, who is this you?
Who is this doctor? We got this card from such and such pharmacy. Is this an intern of yours? No. Is this an intern? And they show everybody, and pretty soon they call you. They're like, this doctor's not here, and 20 people have seen it.
I've seen it.
I haven't done that, but I think it's a good idea.
Slightly related to that is just billboards. Billboard advertisement is so cheap now because nobody does it anymore. Most brands have shifted their marketing budget to digital advertising. But for the same reason, digital advertising is so congested right now. Like, I am so tired of ads. If a brand is spending money like attacking my screen with ads, I almost get annoyed at them, right? Versus there's not a lot of people out there competing for billboards. And so billboard marketing has become a sort of a really affordable way for a lot of startups to sort of establish their name. And it's also why we see really bad billboards now.
Well, you know this, Melinda, but some of these billboards now, because they're all digital, you go right on your phone and you can get 30 seconds every 10 minutes or whatever on a billboard that's the exit of your pharmacy or something like that. You can do it right on your phone now.
Yeah, right in Times Square. It's a great business model for them because people want to be photographed there. It's sort of really cool. But yeah, like thinking about marketing, you got to be a little creative sometimes. You can't really go where the masses are going because consumers get tired if you do the same thing over and over.
If you don't filter out stuff, there's a million things that you would see. Your brain filters out everything because you don't have that much bandwidth up there.
Yeah. I read books about marketing now, understanding that's sort of our value proposition these days. And the average user needs to see your ad. If they don't know your product at all, and this is the first time, they need to see it at least 50 times on social media before they take an action to interact with it. 50 times per user, that's a lot of money when you think about how expensive it is to advertise on Instagram and Facebook these days. And so if you're not a big brand with a really creative and smart marketing director or head of marketing who knows how to make someone slow down and look at your ad for 50 times, that ROI is going to be really bad. And I think like even today, if you think about it, like I think back in the 2010s, there were a lot of DTC brands, right? A lot of direct-to-consumer brands in a sense of they don't have a physical presence that were built. Like a lot of cosmetic brands, shoe brands, clothing brand. That was when nobody really was in digital marketing and they could capitalize on that. But today that strategy is so overused that DTC is a really hard strategy for a lot of startups or a lot of brands. You have to be a little bit more creative and think like yourself, think about physical marketing again, where people are not really overloading on that end. Even like in pharmacy, right? In the 2010s, there were so many of these pharmacies that were doing direct to consumer. And now we see a lot of copycats, but
they're not getting the response anymore.
Yeah, people are so tired of DTC brands. There's a lot of brands that are actually in trouble today because that strategy is overdone, overused, and they have to go into retail stores. And I imagine that this trend is very similar in pharmacy as well, right? Like late 2010s, there were a lot of online pharmacies. And if you aren't Hims or Hers or some of the other earlier brands, any of the copycats that came after them, patients are just completely tuned out. If you think about Amazon Pharmacy, right? They're so late to the game, they can't grab as much market.
I see some of these pharmacy delivery apps come up on the phone. They're getting like $1 billion in funding or whatever.
Yeah.
I think one of them bought for like $1 billion or something. And if they could have talked to me, I could have told them this was late in the game and pharmacies are doing this and you're not that advanced and all that kind of stuff. I think some of these investors have money to throw around.
Oh, yeah. It is wild. I think that's something that I went to pharmacy school, so I didn't learn anything about VC funding. And then now that I'm in this space, it's shocking how much money there is and how much money goes to really bad companies that are led by people who are not in health. I think that is astounding.
Yes, absolutely, for sure.
Yeah.
Melinda, fascinating conversation. Some of these are hard to stop because you and I could talk for hours now getting into the VC stuff and that. It's fascinating. What I want to tell the listeners is you're listening to someone here who has a very good handle on marketing in the new age. And this same person, Melinda, is putting a product in your customer's hand that they're going to see maybe 120 times a month, just one box. And so pay attention to what she's saying and dig just a little bit deeper, see if it's right for you. Melinda, what is the website they're going to go to?
Yep, they would go to parcelhealth.co, and that's spelled PARCEL health.co. A little trivia, I guess, a little random fact, we tried to buy .com, but the person holding the .com domain wanted to sell it for me for $10,000. And I said, no, we're going to stick with .co.
Melinda, it doesn't matter anymore. It doesn't matter. Yeah. With Google, people are going on and they're putting in Parcel Health in Google. You could have really any suffix on that and it wouldn't matter at all. You might have something that looks a little bit off. Well, people have a bad connotation now of .net. .net always seemed like the little sibling kind of thing. But now with the new ones, people don't care. And rarely are people going to put your whole website in. They're just going to look up on Google. They're going to say Parcel Health.
Yeah, I mean, Facebook, when they launched Threads, the competitor to Twitter, it's .net because they couldn't buy .com. So when I saw that, I was like, yeah, you know what? I think we're past the .com age where if you're a legitimate business, you need a .com. But
no.
Yep, we're parcelhealth.co.
.co. Melinda, thank you. Very cool. Keep it up.
Absolutely. Thank you so much for having me. This was a blast. Thank you.
All right, Melinda, we'll keep in touch.